right. Good morning, everyone. Welcome. Welcome, welcome, welcome. I'm so excited to have you here. My name is Jennifer Bonner. I am the manager of nursing services here at Archer Review, and I am delighted to be joining you this morning for our pharmacology guess the medication. If you are someone that struggles with pharmacology, one of the great ways that we have to encourage you to start understanding these medications is by, making a couple games here and there. And so I'm so excited to have you joining me this morning. Whether you're on TikTok, Facebook, YouTube, wherever you are joining me from, I am absolutely delighted to have you. So, before we get started, I want you to go ahead and let me know in the webinar chat, where are you joining me from? So, like I said, my name is Jennifer Bonner. I'm the manager of nursing services here at Archer Review. And so, a lot of what I get to do is work one-on-one with students. I get the opportunity to do private tutoring, webinars, 3-day live is so much fun. Getting to see those aha moments are one of the amazing parts of what I get to do. So I started out as a neuro ICU nurse right out of college. And then I jumped into what I lovingly refer to as the butts and guts of the hospital. So I did a little bit of endoscopy and then I fell in love with women's health. So while I was in the process of becoming a family nurse practitioner, I realized that that was really my passion. So I went back to become a certified nurse midwife. I was at the bedside for probably about 4 to 5 years before I jumped into education. And so I've been with Archer for almost 3 years now, and I absolutely love what I do. I love coming to work every day. Love getting the opportunity to work with all of you. And so I'm seeing some great answers here. We have Nigeria, Quebec, Canada, Wisconsin, Philippines, Toronto, Minnesota, Washington, Kenya. Awesome. So excited to have you. I let's go ahead and check into, let's see, Finland we have. Excellent. So wherever you are joining me from, I'm so excited to have you. I know um, we have people kind of everywhere this morning, which is great. I love seeing where everyone is joining us from. All right, so now I am curious. How do you feel about pharmacology? Where are you at? If you had to rate yourself on a scale of 0 to 5, how would you rate your current knowledge of pharmacology? Okay, I'm seeing some okays, I'm seeing some not great. Okay, seeing some okay, some middle of the road, some threes, some twos, just difficult. Yes, I understand. So, if you are someone that struggles with this type of information, I have a few things that I'd like to bring to your attention, and we'll talk about those in just a minute. But I want to start off our day by saying, what's going on at Archer? So we're going to log into archerreview.com and we're going to head on over to our nursing department and see what's going on here. So we're headed over to nursing. We're going to scroll on down to see this week at Archer Review. So we have Pharmacology Guess the Medication. You made it. On the 15th, we have Level Up Your Nursing Readiness. So that's where we're going to be going through the Rapid 30. We're going to be talking about how can you make the best of the end of the semester, make the best of your time away during your break. And then you're going to see next week we have the pharmacology crash course. Now, the next thing I want to check out is what kind of small groups do we have going on this week? So I'm going to head on over to private tutoring and let's see what we have available. So today looks like all of our private tutoring spots are taken, which is a great thing to have. Tomorrow, there's a spot with Emma for an hour private tutoring session if that's something that you're interested in. And this is in Mountain Time, so it would be 3:30 to 4:30 p.m. Central Time. Wednesday, we have some small groups going. So it looks like we have quite a few of private tutoring sessions. We have test taking strategies with Carly. If you're someone that really struggles with how to break down those NCLEX style questions, this is going to be a great small group for you. It's $25 for an hour. Whether you're getting ready to take the NCLEX or you're in the middle of nursing school, that would be a great one. And then we also have fundamentals. So we're looking at those core nursing concepts, and that will be with Megan, and that's tomorrow. And it looks like we have a private tutoring session with Lauren that's also open tomorrow as well. And then Thursday, we've got some private tutoring sessions available. And then it looks like Saturday, we have a private tutoring session available in the morning with Emma. So if those are any interest to you, go ahead and check those out. You can head on over to the private tutoring to check out the small group offerings. And then we have the webinars coming up as well. All right. Well, I know everyone is here wanting to figure out, okay, Jennifer, how do we tackle pharmacology? So, are you ready? Here's our first medication. This medication is man-made form of the hormone insulin, and it works by lowering the levels of glucose in the blood. This specific type of insulin is a long-acting form that starts to work several hours after injection and keeps working evenly for 24 hours. This medication can be used for type 1 or type 2 diabetes. What medication am I? Seeing some great answers here. Ooh, I thought I was gonna trick you here. Maybe not. All right. Final guess is three, two, one. What medication am I? I am glargine. So glargine is that long-acting basal insulin, right? And it's providing that steady 24-hour glucose control. It's helping to reduce that risk of hypoglycemia between meals, but also overnight. And typically, we give this once a day, same time every day. We don't mix it with other insulins. And so when we give this medication, we want to make sure that we're monitoring that blood glucose and we're watching for those signs of hypoglycemia. Remember, anytime we give a medication, we want to know, is it doing its job? But is it doing its job too well? Okay, we think about that when we give antihypertensives. Is it doing its job? Is it lowering that blood pressure? Is it doing its job a little bit too well where we're having hypotension? Okay, and we also want to talk about how to do those injections and the importance of rotating those sites. So somebody remind me in the webinar chat, what is the angle that we give insulin? Normal BMI, what is the angle that we give insulin? 45-degree angle. You got it. What if my client is obese? What angle do I give that medication? You got it, 90 degrees. Now, something else that's really important when we're talking about insulins is to understand the type of insulins that we have, but also what that duration is going to look like, the peak time, that type of thing. Okay. And so we have our rapid acting. So that's our Aspart, our Lispro. We have our short acting, which is our regular. So we have our intermediate, which is NPH, and our long acting glargine. Which of these insulins could I give IV? Which would I give IV? Regular, you got it. Nice work. Nice job. Okay, so let's say that we administered regular insulin at 8 a.m. So what time frame should we monitor for hypoglycemia? What time frame? We gave it at 8. 10 to 12. You got it. So we need to know that my client is at risk for hypoglycemia during those peak times, right? So 2 to 4 hours, whoops, 2 to 4 hours later. Nice work. Okay, so the next thing we need to understand when we're talking about insulin is how do we store it, right? Insulin storage is really important. So when it comes to that, we want to make sure we keep it out of direct sunlight. So if your house is anything like mine, you have a lot of windows, we want to make sure that this medication is kept out of the windowsills. We don't want it in that direct sunlight, that direct heat. This goes for around your oven as well, because there's heat coming off of there. We don't want to freeze our insulin. Now, just the other day, we were having tacos, and I pulled my lettuce out of my refrigerator, and it was all the way in the back, and my lettuce was frozen. So we want to be mindful of where that insulin is kept as well. But we do want to keep it in the refrigerator until we're ready to use it. And then once we use it, it's kept at room temperature. Okay. Another thing that's really important is we know how long these are good. So my NPH, 1 month. Okay. Glargine, 28 days, and my rapid and short acting, good for 28 days. So what we do is we take that insulin out, we go ahead and use it, and then we go ahead and mark the date on it so that we know when it goes bad. And this is also something that we want to teach our clients as well. Now, the next thing is mixing insulin. And so when we mix up insulin, we're looking at regular and NPH, right? Right. So the first thing that we want to do is if, let's just say this is my insulin needle, and it is really important. I cannot stress this enough, how important it is that when we are drawing up insulin, we're using an insulin needle. Okay. So we're going to pull up however much. So let's say we need 2 units of regular, 2 units of NPH. How much air am I going to draw up in my syringe? How many units am I going to draw up in my syringe? 4 units. You got it. So 2 plus 2 is 4. And then the next thing I'm going to do is I am going to inject 2 units of air into the NPH vial. And then I'm going to inject 2 units of air into the regular, and then go ahead and pull up my 2 units of regular. Then I'm going to draw up my 2 units of NPH. Okay. So I always remember RN. I draw up my regular first, and then I draw up my NPH. So clear, then cloudy. Okay. And I think about that as I would prefer clear skies first over those cloudy skies. And we've talked about this a little bit, but we know that we can only give regular insulin through the IV. Everything else is sub-Q, and we want to make sure that we rotate those injection sites. Somebody remind me, why do we want to rotate injection sites? What are we concerned about? Why do we want to rotate injection sites? Okay, someone's saying skin breakdown, tissue damage. Lipodystrophy. That's right. So what that is that over time, if we're injecting insulin into the same place, what's going to happen is we're going to see that thickening of the skin. And that's kind of, it doesn't feel great, and it's just a very different type of texture to the skin. But the problem is eventually if we have that, that insulin's not going to be absorbed the way it should be. So we want to make sure that they're rotating those injection sites. Okay. So somebody remind me, give me some ideas on where I could inject insulin. Where could I inject insulin? Okay, this in the abdomen, in the rear end, the back of the arms, the thigh. Yeah, you got it. So any of these sub-Q sites are possible. Now, full transparency, I've never used the back. I've honestly never given insulin in the buttock area, but I have given insulin a lot around this umbilical area. I've given it in the back part of the arms, but we want to make sure that our clients have options of where they can go ahead and administer that insulin. Now, we talked about this earlier, but something I want you to know about is our pharmacology crash course. This is 5 days from December 15th through the 19th. We have the lovely Lauren Korth that will be presenting this pharmacology crash course. And this is just a really great review. If you're someone that struggles with pharmacology, not really sure what to do with it, needs some help, this is for you. It is $75, and you can scan that QR code there on your screen that will get you into register for that. It will also come with the recording. But if you are not able to attend and you just want to purchase the recording, I just put that link for you there in the webinar chat, and I will go ahead and put it in the other areas as well. Let me get that in there for you. There you go. So make sure you check that out. All right, next one. Here we go. Sweating, feeling fatigue, dizziness, feeling hungry, shakiness, tingling lips, confusion, palpitations, and becoming easily palpitations, sorry, and becoming easily irritated or anxious are signs and symptoms of what? Medical emergency. Let me know. You got it. That is signs and symptoms of hypoglycemia. Those are one of the things that we need to monitor when we are watching, when we are giving insulin, is we want to make sure, is our medication doing its job or is it doing too good of a job? Making sure that we are not lowering that blood glucose too far. All right, next one. This medication is indicated for the treatment of hyperthyroidism in our clients with Graves' disease or toxic multinodular goiter, for whom thyroidectomy or radioactive iodine therapy are not appropriate treatment options. This medication is dosed once per day. Seeing some great answers coming in here. Ooh, getting some tricky answers here. All right, let's check our answer in three, two, one. It was methimazole. Now, this is an anti-thyroid medication, okay? And what it does is it's inhibiting that thyroid hormone synthesis. And so this is a big one for Graves' disease. Big things that we need to watch out for. We're going to be monitoring those thyroid function tests. We're watching for signs of hypothyroidism. Remember, if we're trying to lower it, we want to make sure that we don't lower it too far. And we're watching for something that's rare, but those really adverse effects like agranulocytosis. So we want to make sure that when we are educating our client, we're talking to them about sore throat, fever, any unusual infections that they might have. Okay. Because they can let us know that they have like a really low white blood cell count. So methimazole, nice work there. All right, here we go. This medication is used to treat diabetes insipidus, which is caused by a lack of naturally occurring pituitary hormone in the body. It can be given at home through a nasal spray, but it can also be used in emergency settings to raise that blood pressure in adults who are in shock. Ooh, you guys are getting this one. I'm seeing epi, I'm seeing ADH. All right, are you ready for the answer? Here we go. In three, two, one. It was vasopressin. Nice work. So, vasopressin is a non a peptide antidiuretic hormone. Okay. It is a very potent vasoconstrictor, and it is also a water retaining hormone that we use to treat diabetes insipidus, vasodilatory shock. Okay. And so, what it does is it increases that water absorption in our kidneys and it raises our blood pressure by constricting the smooth muscle. Okay. So, big things that we need to monitor here are our fluid balance, our urine output, our blood pressure, and those signs of hyponatremia or even decreased perfusion. Nice work on that one. Impressive. All right, here we go. Here's another medication. This medication is a biguanide used in clients with type 2 diabetes. This medication works in three ways. It makes the body more sensitive to insulin, it decreases the absorption of sugar through the intestines, and it lowers sugar production by the liver. What medication am I? Ooh, I'm seeing some varying answers here, but a lot of you are getting it. Impressive. Great job. All right, here we go. In three, two, one. This is metformin. Metformin is a biguanide. Okay. It's a first line oral anti-hyperglycemic agent that we use for type 2 diabetes. And it works by decreasing the hepatic glucose production, but also improving that insulin sensitivity. It doesn't cause hypoglycemia when it's used by itself, but it also often preferred for its weight, natural, or even weight loss effects. But it can cause some GI rumbles, so we want to make sure that our clients know about that. Big things that we monitor for here: kidney function. We do encourage our clients to take this medication with meals because it can help reduce those GI side effects, and watching for signs and symptoms of lactic acidosis. All right. Many of you have been waiting for this medication. Here we go. This is a synthetic thyroid hormone used to treat hypothyroidism. And this is a condition where the thyroid gland doesn't produce enough thyroid hormone. The thyroid hormone is crucial for regulating various metabolic processes in the body, including energy production, utilization, body temperature regulation, and normal functioning of the heart, muscles, and other organs. What medication am I? Ooh, I thought I'd stump you here, but it doesn't look like it. I'm seeing great answers coming through. Well done. All right, this one is levothyroxine. Levothyroxine, that's a synthetic form of T4 that we use for hypothyroidism. So basically, what we're doing is we want to encourage the client that's on this medication. How do we tell them to take this? There's some important concepts we need to monitor here. How do we have our client take this medication? And someone was asking in the Q&A about private tutoring. Private tutoring is individual based and we can work on whatever you need to work on. So if you're struggling with maternity or mental health or fundamentals, you get that individualized time. We have both 30-minute and 60-minute sessions. 30-minute sessions are $40, 60-minute sessions are $75, and you can work on whatever you need during that time. You can also show up and say, "Hey, Jennifer, I don't know what's going on. I don't know what I need. Can you help me? And the answer is absolutely yes. All right. So big things to consider with levothyroxine. This needs to be taken on an empty stomach. So we recommend taking this first thing in the morning, an hour before breakfast. Okay. We don't want to give it with calcium, iron, antacids, anything that's going to impair that absorption. So we're going to monitor those TSH levels. We're going to assess for signs of over replacement. So anxiety, weight loss, tachycardia, and make sure that our client is taking this on the daily. All right, one last look at our pharmacology crash course. It is coming up next week, Monday, Tuesday, Wednesday, Thursday, Friday, from 7 to 9 p.m. Central Time. Remember, that does come with the recording. I believe you get that for 30 days. Or you can also purchase just the recording if you're not able to make it. But that is an amazing offer, amazing value. If you've never learned with Lauren, she is absolutely fantastic. The other thing I want to make you aware of is our SurePass combo. Now, this is our number one recommended program for both RNs and LPNs. If you are trying to figure out how do I get the most time, how do I get the most out of my time that I'm studying, this might be for you. The number one thing that I recommend for anyone getting ready to take the NCLEX, because it not only provides you with our Q bank with thousands of, well, over 2,000 NCLEX style questions, unfolding case studies, NGN type questions. It also gives you, excuse me, access to our on demand videos where you can learn more in depth information, but also our 3-day live review that we offer monthly. And we do this over 3 days where we're going through that most important information that you're most likely to see. All right, we have time for one more medication. This medication is a synthetic corticosteroid medication that belongs to a class of drugs called glucocorticoids. It's used for a wide range of medical conditions because of its potent anti-inflammatory and immunosuppressive properties. This medication mimics the effects of cortisol, which is a hormone produced by the adrenal glands and can influence a variety of processes in the body. What medication am I? Ooh, I'm seeing some great answers here. Let's check out our answer in 5, 4, 3, 2, 1. It is prednisone. Nice work. Prednisone is part of our glucocorticoids. So it is anti-inflammatory, immunosuppressive effects. We use this in conditions like asthma, allergic reactions, autoimmune diseases. If we are using this long term, we can see those significant adverse effects. So, hyperglycemia, hypertension, osteoporosis, even. So, big things that we need to consider as nurses: monitoring those vital signs, watching that blood glucose, encouraging the client, do not stop just taking this medication cold turkey. We're going to taper that off. And if you're having some GI rumbles, go ahead and take it with food. Excellent work today. I am so incredibly thankful to have you in a part of our Archer Review family. Remember, regardless of where you are in your nursing journey, we have a place for you. If you're getting ready to go into nursing school, you're in the thick of it, getting ready to take your NCLEX, or maybe you're moving on and you've decided, you know what, Jennifer, I'm ready to become a nurse practitioner. We have a place for you. We have community for you. And we are incredibly honored to be a part of your nursing journey. Thank you so much for joining me. We'll see you back next week for our Next Gen Nurses webinar series. Take care, guys. Have a great day.